Needle exchanges have a very simple premise. Give users of intravenous drugs clean syringes and take their dirty ones to protect them and others against the transmission of diseases like HIV and hepatitis C. But as News 9's Donovan Lynch reports, a debate at the local level about how many clean needles a person should get is now making its way into the Maine legislature.
In the State House, a measure of public health clashes with a push for public safety.
There are unintended consequences to everything.
Maine's needle exchanges give users of intravenous drugs clean syringes and dispose of their used ones to protect against transmission of diseases, while also trying to get them help in breaking their addiction. Since 2022, Maine has allowed exchanges to give up to 100 clean needles in each encounter with a client. Now, a new bill would bring the state back to the earlier policy of one clean needle given out for each one returned.
In those communities that have been impacted, it's pure trash volume that is potentially a biohazard.
Supporters of the one-for-one needle policy, like Amanda Campbell with the Maine Municipal Association, argue the current looser limit has left communities stuck with syringe waste on streets and in public areas. A state report from 2023 showed around 500,000 more needles distributed than collected in Maine, a headache for city halls around the state.
Municipal officials have to take into account the benefit to all of their residents and not just a single population within their community.
But during a public hearing on this bill on Monday, the state's top health official speaking against lower needle exchange ratios.
Syringe service programs go beyond the syringes themselves.
Dr. Pateri Vaugh, director of the Maine Center for Disease Control and Prevention, says the 100 needles per person not only prevents disease transmission, it's also led to more contact between drug users and the help they need. According to Vaugh, referrals to services for needle exchange clients reached their highest point after the one-to-one ratio was removed.
When we give folks the needles that they need or the services that they need, they also share it with their friends and community members and networks as well. And so that means those impacts goes beyond the individual.
As for the needle waste in towns and cities across Maine, Dr. Vaugh points to alternative solutions that don't limit needles given to users, such as Portland's new needle buyback pilot program. Early city data from that effort shows an increase in needles returned.
We can do both at the same time.
Now this needle exchange bill will undergo a work session before it's voted on by the committee. In Augusta, Donovan Lynch, News Center, Maine.